The American healthcare crisis has reached a breaking point, with record numbers of people unable to afford even the most basic medical care. A shocking new survey reveals that nearly 29 million adults, roughly 1 in 10 Americans, are now unable to pay for essential healthcare services, marking the worst affordability crisis since researchers began tracking this data in 2021. The findings highlight a stark and worsening reality. Access to quality healthcare is slipping further out of reach for millions, and the gap between those who can afford care and those who cannot is widening at an alarming rate. The situation is especially dire for low-income individuals and minority populations who are bearing the brunt of rising costs, disappearing safety nets, and cuts to vital health programs. Among the most concerning findings is the dramatic increase in the number of Americans classified as cost-desperate, people who cannot afford necessary medical treatment or medication. This category now includes 11% of all U.S. adults, a 3% increase since 2021. However, within specific demographic groups, the crisis is far worse. Nearly 1 in 5 Hispanic adults, 18%, now fall into this category, marking an 8% increase in just 4 years. Black adults are also seeing a sharp rise, with 14% now unable to afford health care, up from 9% in 2021. Meanwhile, white adults have remained relatively stable at 8%, illustrating the growing racial disparity in healthcare access. But the most devastating impact is felt by the poorest Americans. Among households earning less than $24,000 per year, a staggering 25%, 1 in 4, now fall into the cost-desperate category, up 11% since tracking began. This means that millions of the most financially vulnerable citizens in the country are regularly forced to go without medical care, facing the very real possibility of worsening health conditions, medical bankruptcy, and even premature death. The crisis is being fueled by several dangerous trends, including skyrocketing medical costs, persistent shortages of essential drugs, and major rollbacks in Medicaid enrollment. Cuts to the Children's Health Insurance Program, CHIP, have also played a significant role, leaving many low-income families with fewer options for affordable care. As government support erodes, the burden of paying for health care falls increasingly on individuals, many of whom are already struggling to make ends meet. Even among those who are not yet in the cost-desperate category, financial insecurity related to health care is growing rapidly. Only 51% of Americans now qualify as cost-secure, meaning they can both access and afford quality care without significant hardship. This is the lowest level recorded since the study began. For Hispanic Americans, the drop in healthcare security has been especially dramatic, plunging 17% since 2021, leaving only 34% classified as cost-secure. Black adults have also seen a steep decline, with only 41% now able to afford care, down 13% in just 4 years. By contrast, white adults have maintained greater stability, with 58% still considered cost-secure. The financial divide is also starkly evident across income levels. Among households earning under $24,000 annually, only 23% are still cost-secure, a devastating 14% drop since 2021. For those in the $24,000 to $48,000 range, the situation is only slightly better, with just 30% maintaining reliable healthcare affordability, a decline of 12%. These numbers indicate that a growing percentage of working-class and low-income Americans are falling into financial distress simply because they need medical care. The consequences of this crisis are impossible to ignore. More than one-third of Americans, 35%, now report being unable to access quality health care when they need it. This is an increase of 4% from just last year and 6% since 2021, indicating that affordability is rapidly deteriorating. Lower-income Americans are again the hardest hit, with 64% of those earning under $24,000 a year saying they cannot access affordable, quality health care, an 11% jump in just a single year. The problem is also worsening for households earning between $24,000 and $48,000, with 57% struggling to access care, up 12% since 2023. In stark contrast, higher-income households, particularly those earning over $120,000 annually, report no significant change in their ability to afford health care. This means that as the rich maintain their access to quality care, the poor are being increasingly left behind. The healthcare system is rapidly becoming a two-tiered structure, one where the wealthy enjoy reliable, high-quality medical services, while millions of others are left to navigate an unstable and increasingly unaffordable patchwork system. Age also plays a significant role in healthcare affordability. Older Americans, particularly those over 65 who qualify for Medicare, are generally shielded from the worst of the crisis. Only 4% of seniors fall into the cost-desperate category, a slight 1% increase since 2021. However, for working-age Americans, the situation is deteriorating much more quickly. The number of cost-desperate individuals has risen 3% among those aged 50 to 64 and 4% among adults under 50, meaning that younger generations are experiencing a growing healthcare affordability crisis with no signs of improvement. Beyond the statistics, the real-world consequences of this crisis are devastating. According to additional research from West Health and Gallup, 12% of U.S. adults borrowed money to pay for healthcare last year, resulting in an estimated $74 billion in new medical debt. Nearly 60% of Americans now say they worry about falling into medical debt due to a major health event, and many are already cutting back on essentials such as food, utilities, and housing just to afford necessary treatments. Others report staying in jobs they dislike purely for the health benefits, unable to risk losing their insurance. The current trajectory of the healthcare system suggests that, without significant intervention, the situation will continue to worsen. Rising costs, government cuts, and growing inequality are creating an unsustainable system where only the wealthy can afford to stay healthy, while millions of others face a grim reality of financial ruin and untreated illnesses. Lawmakers have so far failed to take meaningful action to address this crisis, and the proposed cuts to Medicaid and healthcare subsidies threaten to make the problem even worse. If these policies move forward, even more Americans will lose coverage, pushing the number of cost-desperate individuals to catastrophic levels. The rollback of government support will not only force millions into medical debt, but will also lead to preventable deaths as people are left with no choice but to forego life-saving treatments. The American healthcare system is at a breaking point, and the choices made now will determine the future for millions. Without urgent reforms to reduce costs, expand access, and provide better protections for the most vulnerable, the healthcare divide will continue to grow, leaving millions of Americans without the care they need. The question now is not whether this crisis will deepen. It already is. The real question is whether those in power will act before it is too late.